hope everyone can see my screen. So this is just basically what we'll be covering tonight. So I think one thing that I never realized before is that hair is actually very, very important. It's never just hair. And I think that's why it's something that's so important. Hair loss, thinning, stress, all of these things affect our confidence. You know, they don't say it's a bad hair day for nothing. And mostly this is not cosmetic problems, it's follicle biology problems. So when you look at your hair, there's a lot of products out there that say, for instance, this will do this for your hair and that and whatever, but it's very important to remember that your hair strand is actually dead. So if you want to really have an effect on your hair growth, hair shedding, hair loss, all of those type of things, you need to focus on the follicle because that's where the problem starts and that's where you'd be able to reverse it as well. So as you can see there, bullet point number 3, density, thickness, color, and resilience are all decided at the follicle, not at the hair shaft, not on the hair itself. So what you be putting on your hair is irrelevant. That's not going to make any difference to what's happening in your follicle. And then understanding this biology will just make it easier for you to understand where certain products work and why they do make a difference as well. So I would say the first thing to remember is to see your hair follicle as a little mini organ. And remember, it's very sensitive. I think all of us know people that have gone grey overnight or have started losing their hair. If it's very sensitive also to what's happening in your life, whether you've had a lot of stress, whether you've lost a lot of weight, whether your thyroid is underactive or overactive and everything as well. So as you can see here, your follicle is very dynamic. It's a cycling structure. I never knew that myself as well. So it also has a circadian rhythm. It's also affected by cortisol, also by melatonin. So if you're not sleeping, your follicle's also feeling it. This is a good thing for you. It's one of the only structures in the adult human body that's capable of complete cyclical regeneration. So that means obviously it's always better to treat faster than later. But while your follicles are getting smaller and smaller or going dormant, if you start doing something about it, you can turn that around. It's regulated by your hormones, circadian rhythms, your nervous system, immune response. It's not just an isolated thing. As you will see tonight, there are actually 6 different drivers of hair loss, not just one hormone. All these stories that I've been reading up on Facebook saying, did you know it's this one hormone that's affecting your hair growth? I mean, obviously that hormone does play a role, but that is not the total story, and I want you to see the full pictures. So here we have it. What are the 6 pathways that affect hair loss? So it's not just a single thing. Firstly, chronic stress. So cortisol pushes your follicles into catagen early and it depletes your melanocytes. That's why people turn gray as well when they have chronic stress. Stress is very bad for you in all levels. Oxidative stress, UV, pollution, ROS damage your follicle membranes and also your pigments. So that's why you have to protect your follicles from oxidative stress. Hormonal, this is where DHT fits in, also your thyroid. Both of them can affect your hair growth as well. DHT mostly for males, but there has been this whole rise where they've been saying that a lot of females, also from 40 plus, there's an increase in DHT, and this is suffocating their follicles, affecting their hair growth as well. Microbiome dysbiosis, that's also very important. Sometimes people have some sort of fungal overgrowth like cradle cap or, for instance, sensitivities. Remember, if that whole environment is not optimal, your hair's not going to grow well. So that's why it's so important to balance your microbiome. Nutritional deficiency, this is from people that have low iron, biotin, that don't eat proteins, that maybe are on GLP-1 agonists and don't eat enough. So they have a nutritional deficiency on this point. If you do supplement with some of these nutrients there, it will obviously help for your hair growth as well, but only if it was the causing factor for your hair loss. And then one that's very interesting, and we're addressing this in a new product that I will be launching soon, is that the growth factors are declining. So this is something that's naturally present as we age, when you start getting to 40 plus, the growth factors decline, and this also has other type of effects on your hair. So obviously when we spoke about stress and hormones and things, that's when people have like diffuse shedding of hair. But now we're talking with growth factor when you go into menopause, post-menopause, etc., you might find that your hair's maybe not falling out, but it's much thinner than it used to be. And this is because of the growth factors that are declining, and there's various factors that play a role there as well. So yeah, the one that's getting a lot of attention these days is androgenetic alopecia, and this is addressed by DHT. Affects roughly half the men and many women over 50. This is just per what I could find. So what is DHT? This is formed from testosterone by 5-alpha reductase, and it binds to these androgen receptors, and it basically just causes your follicles to get smaller and smaller until there's no more hair growing out there, and the hair becomes finer and finer as well. There is certain drugs that is DHT blockers, such as finasteride, and they can be used mostly by men, but they do have some side effects as well. So you can see there's some sexual side effects, some depression sometimes as well. And it's obviously not something that is given as a first off to females because it is contraindicated in pregnancy as well. I found a lot of things on saw palmetto on the internet as well. It's actually a herb that's mostly used for men for their prostate because obviously DHT plays a role there as well. I haven't really come across any data on saw palmetto for females or even topically, but that is definitely quite a big trend and something that people have asked me about. So DHT will definitely how can I say, excel or make your hair loss faster. So if you think in pictures, you can imagine this DHT is like somebody putting a foot on a pedal. It's just accelerating the hair loss. And then you've got cortisol. That's another foot. It's also got also on the pedal, just accelerating it even faster. So Densidol actually works on the second part that it lifts the foot off the pedal for the cortisol and the stress. So you don't have that enhanced faster effect. So it indirectly blocks the DHT, but it's not a DHT blocker per se. It's obviously much safer and everything as well. I don't want to go into too much details here, but obviously there is thyroid dysfunction also that affects your hair loss, whether it's an underactive thyroid or an overactive thyroid. But you would know if your thyroid is the culprit because there are some signs and symptoms. People are generally quite cold, they're sluggish, their digestive system slows down, their skin texture might change a little bit as well. And then it's also diffuse hair loss. It's not like it's just at your temples or at your crown as well. Nutritional deficiency, as I said, this is not always the reason why, but if you do have a nutritional deficiency, your hair will definitely improve if you then address it as well. And iron is one of the biggest factors that play a role there as well. And then number 6, growth factors. I think everyone knows growth factors work. I Googled a few aesthetic clinics that focus on hair loss, and quite a few of them are using growth factors, and they do PRPs as well, etc. So they do know that growth factors work. It's been around for 30 years. Not just for hair growth, but also for skincare. But the problem is that it's not stable. So most of the product that have growth factors is, I think I had it here somewhere, it is usually, by the time that it would be in a product, it's only got like a shelf life of 6 hours. So it was previously very not feasible to formulate something like that. But these days, the growth factor that I'll be looking at is imported from France. It's manufactured in an oleosome, which means it's a plant cell that protects it, and it's stable for 2 years and it absorbs very well. So this is something that's quite different Also, these growth factors are not linked to cancer at all. That's a question that people usually ask. Will this now, if it enhances my growth factor levels, will it make other cells grow as well? No. As I said, most people, especially females from 40 plus onwards, their growth factor levels are decreasing. It's something that's naturally present. I love these type of ingredients, something that is naturally present in your body. You're just replenishing what you are losing, and therefore it like revitalizes your follicle as well. Yeah, here you can just see I just put some info there on how unstable the growth factors is. You've only got 6 hours, but now obviously this has changed with some new technology that has become available as well. So this ingredient is called Pureva. It's growth factor innovation without a needle. It's 8 times more stable than conventional native growth factor. You don't have to have injections, blood drawn, or clinic visits. And then the nice thing about this is as well, so with hair loss, it's always complex. I always tell people, even with the current product that we have on the market, you have to be diligent. You have to use it every day. Don't expect results overnight. I've had some really great feedback from people, but in all honesty, if you look at the clinical data, you have to use it for at least 3 months or 5 months for the best effect. This growth factor is a little bit different. It fits in with my 40 plus, 50 plus people that feel their hair's thinning, they don't have a lot of time. This one can be used twice a day, and yeah, they actually showed results within 28 days. There was something like a 33% increase in hair density, which is absolutely amazing as well. So what makes a good product? So what should you look at when you evaluate all these products that are on the market for hair growth? And for me, there are 3 things that stand out. The first thing is look for trademarked or studied actives. So people can tell you a lot of stories. They can make a very nice story about anecdotal things, and my grandmother said this used to be this way, and etc., etc. And remember, herbs are not all the same. I'm quite an expert when it comes to herbs, and I can tell you now, there's a million things that affect them. One extract is not the same as the next one. You need to have something that's standardized, that you know that you're using the same thing all the time, and you want trademark studied actives that have real data on them, not subjective, oh, I feel my hair is thicker or whatever. With tests that they've done, you can see their objective assessments, and there's validated external tools. They usually shave a piece of your head, and then they've got a tool that takes a picture, analyzes how many of your hairs is in which phase. It can also take pictures. I've received all of these ones for the actives that I do use. So it's not like you can affect your own results. You can obviously feel that your hair is feeling better and see that there's less gray hairs, whatever, but it's an objective assessment, it's not subjective. And then matching inclusion levels. So it's no use you find a trademark active that's got the studies, it is objective, and it's tested at, let's say, 1 or 2% inclusion. Now you decide, okay, but I'm going to include 0.1% because I'm saving cost. Then you can't possibly expect to get the same results. So these 3 for me are non-negotiable, and all the products that I do have comply to all 3 of these. They're trademark, they have data in vitro as well as in vivo, and it's based on the exact inclusion that they use in the clinical studies as well. So soon there will be 2 scalp treatments that I have available. Currently, we have the Vitin Scalp leave-on treatment. So this is for dry, sensitive scalp as well, because it's got 2 actives, both microalgae based. Densidol, there is a slide on it. I'll touch on it just now. And then also Bioskin, which is a probiotic. So it's very good to soothe your scalp. A lot of people that actually don't even have hair loss or premature graying just use it for the soothing effect that it has on your scalp. So it helps for gray hair, barrier support, hair loss, and you use this at night. Why do you use it at night? Because remember we said that this whole hair loss is facilitated or accelerated by stress. So what Densidol does is like a 360-degree protection for your follicle. So it protects it against the effects from stress. It actually has two effects. The one is it protects you from stress, that reduces the effect from cortisol, increased melatonin. So even though you might not be sleeping, your follicle thinking you're sleeping because you are just simulating that whole circadian rhythm. And then remember, we spoke about oxidative damage and how detrimental that is to your follicle. So it also has a very strong antioxidant effect, neutralizing the ROS so that your follicle can stay very, very healthy. So what is this ideal for? Shedding, stress-related loss, premature graying, itching, or sensitive scalp. You use it at night. Then I also often have people that say to me, oh, I've got such an oily scalp, I don't know what to do about it. Or they are very impatient, they want results quite fast. Maybe they had a thyroid thing, or they had quite diffuse, or they went for operation, so they had quite diffuse hair loss. So this one is then will be called the hair regrowth serum. So you can use it in the morning or at night. It does have an effect on excess sebum as well, that they found on day 28, so it helps balance that too. And this is more for thinning hair, reduced density, where people, because with this one, you could see an increase in the hair shaft density within 28 days, and people that want faster results, that want to use something twice a day, will not do anything for gray hairs. Gray hairs all covered by Densidol, especially premature graying, because of the effect that it has on stress as well. So, as I said, Densidol, this is our star ingredient that's in the Whiten Scalp Leave-On treatment, microalgae based. Two things: emotional shield, environmental shield. So, basically, you are stressing, your follicle suffering, and then this is just protecting your follicle from yourself and the stress and the cortisol and not sleeping, and then also from the environment. What results can you expect from Densidol? So you can see there an increase of 11.4% hair density in 5 months, 10,200 new hairs in 5 months, less 24% or reduction in gray hair at 5 months, 25.9% increase in the anagen phase recovery. And then they tested Densidol in vitro versus minoxidil, and it had a 200% bigger effect than minoxidil. And then obviously look at that very nice antioxidant effect that it has in vitro as well. And then the nice thing is it's completely safe. There's no alcohol in the formula. It can be used during pregnancy and lactation. Also perfect for people when you've had a baby and maybe your hair's falling out, but you are still breastfeeding, or, you know, you don't want to use something harsh on your scalp. I mean, I myself have used minoxidil for quite a long time. I know it is very harsh. You can't compare it with this one. It's very, very soothing, and you definitely see the difference in your hair and even in your scalp, and, you know, just in general, the way that it feels. Then the secret ingredient with it is remember we spoke about the microbiome. So obviously very important to keep the environment of your scalp healthy. And then the bioskin is also in that product. So this works against cradle cap as well. I've got so many people, like I say, that use the scalp leave-on treatment because they've got sensitive scalp, and then the beneficial effects on the hair is just an add-on. Bioskin is also included into the shampoo and the conditioner, and the reason for that being is that they have two sets of data. So they've got data where you have it as a leave-on, where it soothes your scalp and it helps for cradle cap and fungus and all of those type of things, but even as a wash off at a different concentration, where it also works with reducing sebum and just protecting the environment of your scalp. Is then the hair regrowth serum as well, the one that's got that growth factors in. So it works on 5 different functions. As I said, this one increases, you'll be growing more hairs, density, follicle recruitment, increased shaft thickness. It also helps for scalp hydration and balances your sebum production. And with this one, they got a the results quite fast, but it was twice daily application. Within, at day 28, there was a statistically significant change already in the hairs, which is unheard of. Usually you have to wait 3 to 5 months. So at least now there is the option for people to use it. This is not always either or. If there's people that really have issues with their hair, you could always use both of them. Use the hair regrowth serum in the morning if you wanted to, because it does have that effect on balancing the sebum, and then you can use the Vitamin Scalp leave-on treatment at night, or you could just stick to either one. As I said, why this one is so remarkable is because you could see results within 28 days. So obviously, I do believe that people should use the whole system. There is a shampoo with the bioskin. The conditioner is coming as well. That's also very, very nice. Makes your hair feel very soft. Also contains the bioskin, sulfate-free, very gentle on your hair as well, and just sets that right environment. Then we've got the scalp leave-on treatment, which you use at night. As I said, supports follicle repair. Remember, everything is about the follicle, anti-graying and scalp barrier health. So very, very nice and soothing on your scalp. And then a new one that I'll be launching, the hair regrowth serum, you can use in the morning or even twice daily. Stimulate the follicle activity. As I said, growth factor is decreasing, and this is just replenishing it. The reason why I brought in this ingredient as well and the second serum was because of a talk that I listened to, where so I'm sure some of you know that I'm working on a 50+ range, and this person was saying that 40% of females at age 50 have hair thinning. So it's not just hair loss, it's hair thinning, because obviously there's some hormonal changes and etc. So I thought, you know what, it would be nice to have something in the range as well that helps for hair loss, but is also for hair thinning. And maybe at that stage, it's not so much hair graying and things anymore, or you've got a very oily scalp or other reasons, or you want faster results, you want to be able to use something twice a day, to have that option as well. Something that's very unique about these ingredients, I wonder if I said it, but I'll just mention it here, is remember, any ingredient is only as good as what it absorbs. So you can have an ingredient that's in a product on the market, and you would have no idea if it's actually reaching the area where you want it to work. So if we go back to Densidil and Bioskin, they are both in liposomes. That means that they are absorbed very well. There's obviously no alcohol in the formula, but the liposome makes it gets to the follicle, it gets absorbed, and it does what it's supposed to do. You apply it, you massage it in, and you leave it on. Then the same with the growth factor. It's an oleosome, which means it was grown in a plant. It is got this protective layer over it, and it increases the stability, and it also helps with the absorption. So from that perspective, it's also great. Plus, it has the data to show that it actually works where it's supposed to work, where people can say, oh, well, I've got this extract, but it hasn't been tested. So you've got no idea whether it's actually doing what it's supposed to do. And I can tell you now from experience as well that all herbal extracts, or the majority of them, are ethanol extracts. That's the best way of extracting a herb. Might not be the best vehicle to be using on your scalp. So how are we different? How's Vitin different versus conventional treatments? So conventional ones would sometimes, like minoxidil, it forces you into anagen artificially. So once you stop using it, your hair just falls out again. So it works fantastically while you are using it. It is still a drug, so it does have side effects as well. Then you've got your DHT blockers, but they do have hormonal side effects. You actually have quite good absorption from your scalp, from drugs and things. So you could have systemic side effects from that too. And none of these addresses the oxidative stress, cortisol, your microbiome, or premature growing. It will just force your hair to grow, but it's not it's not a holistic way of looking at your follicle. So what are we trying to do with Vitin? It's all about restoring the follicle's own biological program. Remember, now we're working on the circadian rhythm, we're working on the external factors, we're working on certain, like the growth factors that are decreasing with age. There's an indirect effect on DHT as well. Like I said, with Tensidol, so it doesn't directly block it, but indirectly it does affect it as well. There's no hormonal interference. It's very safe. No alcohol, no sulfates or anything in the formula as well. And then it does help for stress. Stress is very bad for you. And I think all of us know we're supposed to sleep quite a lot. We don't. So then this is definitely a more holistic way of looking at it. So modern hair loss management to me is no longer about forcing growth. It's about restoring that follicle biology. And nothing in life is ever so simple. You know, hair loss can't just be a single hormone story. That would be way too simplistic. There is obviously always some truth to these things, but as you saw, we touched on it tonight. There's 6 different pathways that you should actually, or that can affect hair growth. So just focusing on one and having zero ingredients without any data is maybe not the right way to look at it.